So Michael, Lilley, welcome to the Isle of Wight County Press. You're standing in the newly formed Isle of Wight East constituency for the Isle of Wight Liberal Democrats. To start with then, we've got a range of public questions that people have written in to us. First one is on the ferries. Islanders say that they're overpriced, unreliable and have been for many, many years now. Nick wants to know exactly what you would do to improve cross-Solent travel should you be elected.
They're totally right. I mean, it's terrible. I travelled on them last night and it wasn't terribly good. The main thing is a regulator. We actually need, and I've advocated for many years, an Island Equality Act that would be part of getting a regulator for the ferries, but also actually looking at their ownership, because part of the problem with the ferries is they're owned by a company, and the profits are moved. And I would want to see legislation that actually stops that, so you're actually dealing just with one company. And I would like to see that bodies like the Isle of Wight Council have shares or some kind of public ownership in that.
How would you, as the MP, get that point across?
Well, firstly, most MPs, whatever parties they are, use private members' bills. You actually need to have members in the House of Lords. The Lib Dems have 80 within that. And if people remember, we used to have a Lib Dem many years ago called Stephen Ross, who was very successful at getting private members' bills. So I would be using that route.
Okay, and moving on to dentistry now. We know the struggles. People have to get appointments, young and old, people have been struggling. Health Watch Isle of Wight says it's a big problem and distress has been caused to many, many people. Mike wants to know what you would do about that.
Well, it's what I'm doing actually now. I was chair of the Policy and Scrutiny Health Committee, and I brought the commissioners together with the NHS dentists, which are at Denby House, because we only have one sole dentist practice that is totally NHS on the island. And we've had meetings and we're actually looking at doubling the service there and also getting a scheme into schools, because our children's teeth in the island are appalling and we actually need to do something about it. I would also be campaigning to get the government to increase the rate that NHS dentists are paid.
Okay, and moving on to storm overflows, we know that there's been sewage discharges off the island, namely in Cowes last year, 5,000 hours of storm discharges, sewage releases essentially. What would you do and how would you hold Southern Water to account and stop sewage pollution, not just on the seafront, but in the rivers and estuaries? And that question's from Michael.
Again, I've been doing it with working with Surfers Against Sewage and Southern Water, and we've been developing a charter. The Lib Dems got a successful motion through the council in May this year, and actually we've already got a plan with Southern Water to have the whole island with water butts, a water retention scheme, so that actually that surface water flows away from going into the sewage, which at the moment of that, and also increasing the flow of the pumping stations, like in my own council ward, in Ryde Apley and Elmfield, by doubling that flow to the treatment treatment centre in Sandown.
Okay, and moving on to energy bills now, we know they're about £400 higher than they were 3 years ago, for example, and that's despite the price cap fall coming next month. What would you do to support islanders who are struggling in the cost of living crisis?
Well, one of the big things is to help with fuel poverty, and one of the things is being a founder and director of Wight Community Energy, which actually puts money into the Footprint Trust to actually help, and local town councils like Ryde Town Council give annual grants to the Footprint Trust to actually help people to reduce those. But one of the things is we need a long-term plan and I believe that should be solar on the island. And Ryde, for instance, is already got a feasibility study to become the first island solar powered town.
Okay, and education. We know that a lot of people want the education outcomes on the island improved and support for schools as well improved. How would you set about achieving those goals?
Well, one of the things I've already done was I made sure I was on the appointment panel to have a very good director, because I believed under the previous Conservative administration that put our education under Hampshire actually hasn't been good. We've now got that control back on the island, and we've appointed an excellent director who's now actually working on a realistic school place plan and actually looking at improving our schools, and that will be published in the autumn. So as an MP, I'd want to work with that director to actually get higher standards within our schools.
Okay, and moving on to the NHS now, we know that St Mary's Hospital struggles for its availability with beds. You've got the extra pressures in the holiday months, winter and summer as well, and you've obviously, of course, got the mainland to factor into all of that. How would you support and improve NHS hospital care on the island?
Well, one of the big things is prevention, and the Lib Dems are about putting major money into public health. Because if you can actually stop people going to the hospital, that will actually ease. And we've got to actually improve social care and really invest in social care on the island, so that actually if people go into hospital, then they're able to actually come out and you free the bed. Part of the problem is the blocking. We do need to get much more governance on the island for the NHS, particularly when people have to go onto the mainland, and we need to make sure that journey is free and also less stressful than it is currently.
Okay, and on a more local level, GP surgeries, we know some are closing. People have been struggling to get appointments, much like in dentistry. How would you support making more appointments available?
Well, one of the things that I've done, particularly when I was Chair of Health, was actually help Argyle Street from not being closed by getting new GPs to take that over. And I'm working very closely with Solent Health to make the same in Wootton, so that Wootton comes. The key is you've got to work closely with the providers. The interesting thing about Solent Health is they're now employing GPs, because part of the problem with GPs has been they've been getting older on the island, and then they want to sell up, and young GPs don't have the money to buy those practices. So we need a completely new model on the island where actual GPs are employed. And I would be, again, working with the relevant bodies on that.
Okay, and going on to crime now, we know that ASB, stop and search, dispersal orders, bobbies on the beat, crime levels are all key policing concerns here on the island. If you were to work alongside Donald Jones, the PCC, if elected, of course, how would you set and achieve goals in those areas?
Well, I've worked closely previously and campaigned for local police stations to be reopened, and have bobbies on the beat, which is very much part of Lib Dem policy for community policing. But we shouldn't be unnecessarily criminalising people. One of the things is we need lots more youth provision. You've had excellent youth services provided in Ryde by Ryde Town Council, and you've now got services happening in Sandown, but it's a postcode lottery. And a lot of the areas where the trouble is, there isn't good youth provision. So we need to be preventative and put investment. So I would want Donna Jones to look far more at that.
Yeah, and I was going to ask, how would that be funded then? Because it's all well and good on paper saying you want more youth hubs, and how would you seek to fund that?
Well, Ryde Town Council has actually funded it through their precept. And also got major money for a new youth centre through the government. So it's basically partnership, and we could actually work with the police commissioner. So all the town and parish councils and the Isle of Wight councils could develop a funding formula that actually, with the police crime commissioner, who's actually got access to funding for this. And there's been a number of examples of good partnership in that regard.
So these are quick fire ones, so there'll be one word answers.
Yeah.
The first one, yes or no, would you nationalise trains? One
Yes.
word. Yeah. Yes. Okay, and would you push to rejoin the EU?
No.
Island or party first?
Island first.
National service, yes or no?
No.
Energy, nuclear or alternative?
Alternative.
Should 16-year-olds be allowed to vote?
Yes.
You're quite synonymous with Ryde. You were, of course, the mayor of Ryde, and you've been a councillor there for many years. How are you relating to voters outside of just Ryde, of course, because Isle of Wight East isn't just Ryde, is it?
Very well, because I was a founder of Sandown Aviation Museum. I was the chair of the voluntary sector across the island, so I know a lot of organisations like the Wellbeing Cafe in Ventnor. And also I've been the Isle of Wight's mental health champion. So people in these areas know me and know me very well. And my message is I helped transform Ryde and actually bring in have the vehicle to bring in nearly 40 million into Ryde. I believe I can bring in 50 million into the east, and that's my message: is vote for someone with a track record, not just words.
Okay, and previously in the last election, Lib Dem stood their candidate down on the island so that the vote wasn't split. What's different this time around?
Well, I think when we need to give choice, I disagreed that the Lib Dems stood down at that time. I don't think that was right, and a lot of the voters that I actually speak agree with that. The Lib Dems have been the only party in the past that's actually defeated the Conservatives, with Stephen Ross, which was probably our best MP that we've ever had on the island, and then Peter Brand. And I hope to follow in their footsteps. I think I've got the green credentials to do that as well.
Okay, and moving on to the final set of questions, so you've got a minute for these ones. As MP, if of course you're elected, what would your first 3 top priorities be?
Well, one, get a very good team, because the MP gets about 350,000 to employ staff. So I would want an excellent team that was there on the ground working for me, helping with cases, listening to people. The other priority, the big priority, is to get an Island Act going and actually focusing on the ferries. If we can actually tackle the ferries, then that economically will have a big help to the island. And it's very important to the east, because everything comes from Portsmouth through to Ryde on the train down to Ventnor. So that's essential. And then the third one very much is looking at housing and the chronic crisis of people that can't get rented accommodation. We need to have equality on the island.
And if the other MP elected in the West constituency wasn't Nick Stewart, wasn't the Lib Dems, and was of an opposing party, how would you work with them?
Very well. I've been an Isle of Wight councillor for a long time, and you have to work cross-party. So, for instance, we got through climate emergency, things on the sewage, a range of poverty that I have led as motions, which I've had to talk to the Conservatives and all the other parties to get through. And I've worked very closely with Bob Seeley on individual cases. So I wouldn't have things like, I like them. There isn't anyone I don't like. Mm-hmm. So we work together for the benefit of the Isle of Wight. Okay,
and very, very finally, why should Islanders trust you to be their MP?
Because I've got a track record. As you said, I was mayor of 4 years, right through COVID, and I was the chair of the voluntary sector through COVID. I helped organise on all the communities to actually get support. Just go onto my website and look at my track record. I've always been honest, genuine, and I act, not just speak.